So someone might wake up in the morning with a very painful rash. Shingles is also called herpes zoster. And because chickenpox is a herpes virus, when people hear herpes, they think, oh, herpes is a sexually transmitted disease. But no, there's multiple types of herpes virus. Chickenpox is one of them.
Did you know that reactivation of chickenpox virus in the body is known as shingles? Well, that's what we're going to talk about today. So, Dr. Sanusi, you're welcome.
Thank you, Francisca. So, shingles. Why is shingles an issue? Why are we talking about it? Most people have had their vaccines. Most children now between the ages of 0 to 21 were either immunized with chickenpox vaccine or they got the chickenpox, which is rare to get. So shingles is actually, it's a rash that comes up. And the reason the rash comes up is because when you got the chickenpox vaccine or you got the chickenpox illness, a little bit of the chickenpox virus kind of migrated into the nerve endings. And remember how the CNS is. You have your brain, you have your spinal cord, and out of the spinal cord comes nerves. So what happens, like when you have the chickenpox infection or you have the chickenpox vaccine, those chickenpox viruses can migrate into the nerve endings of the cells. Then as one gets older, if you have a situation where you're highly stressed and your immune system is low because you're highly stressed, those chickenpox viruses that have been sleeping in the nerve endings of the spinal cord, they can show up, and then they show up in dermatomes. Dermatomes basically are the nerve endings that supply the skin or that are on the surface of the skin. So someone might wake up in the morning with a very painful rash. Shingles is also called herpes zoster. And because chickenpox is a herpes virus, when people hear herpes, they think, oh, herpes is a sexually transmitted disease. But no, there's multiple types of herpes virus. Chickenpox is one of them, and it's not an STD spread. So when children have chickenpox with the herpes zoster, they have this rash that is usually one-sided. So it can take one part of the body. They can have it on the face, they can have it on the neck, they can have it on the chest, they can have it on the trunk. Usually it's on one side of the body, and it's extremely painful. Plus, it looks like vesicles. What are vesicles? It looks like bumps that are fluid filled. And when parents or when they see you wanting to touch it, they kind of like cringe and they're kind of like extremely uncomfortable, and they're guarding because they don't want you to touch it because it hurts so much. Now, how is the diagnosis made? Most times it's a clinical diagnosis. You look at the rash, you're like, okay, you get a history. Most times you hear severe pain and you hear, oh, it came up all of a sudden, but they were having pain in that area for a few days. And when you see it, you can't miss it. Usually it's always unilateral or one-sided. So if you have shingles or herpes zoster, what is the next thing you need to do? Usually we want to give you pain medicine because that thing is extremely painful. We also want to put you on an antiviral agent, which is called acyclovir oral. Some people say, oh, just do the topical acyclovir cream and it will be fine. That usually doesn't take care of it. Really? You want to take care of it from the inside. So you take the medicine. Most times the medicine is it can be anywhere from 5 to 10 days. Most times it's 8 days. And depending on which of the antiviral agents you're taking, acyclovir or valacyclovir, or your doctor will decide which one is best for you. You want to take it and drink a lot of fluids, because when you drink a lot of fluids, that makes the medicine get into your system and kill or decrease those symptoms as quickly as possible. Now, it might not be 100% possible to remove those viruses from the nerve, so you might end up having that zoster every few years. Oh, because it stays in the nerve endings, and they live there. They're now commensals, or they're symbiotic with your body. But you want to make sure your immune system is always boosted so you don't get those herpes zoster or shingles recurrently, because it can be very painful. Oh, no. Most people that have it, they know. So as soon as they start to get it again, they might feel some pain. They take their acyclovir, and that usually will help to minimize the severity and the duration of the illness. And in general, especially it's more common in adults. It's not as common in children. But as people get older, they even tell adults, oh, go get your shingles vaccine, which is the chickenpox vaccine, so that you can have antibodies to fight it. And most times when parents know about it and the child starts to complain, they know to go and get the medicine so that they don't have very severe symptoms. And that's really what shingles is, or herpes zoster. Chickenpox, long-term long-term effects, yes.
All right.
And that's what it is.
All
So
right.
if you ever hear of shingles, you ever hear of herpes zoster, it's not sexually transmitted. It's chickenpox in your nerves that has been there long term, and most times it will live with the person until the person dies. But the goal is to stay well hydrated, eat a lot of fruits and vegetables, keep your lifestyle, healthy lifestyle changes going, sleep well, try not to be stressed out by anybody, and just make sure that you're taking care. If you want to put cream on your lesions, some doctors put a cyclovir cream on that. You can go ahead and do that. Some people use lidocaine cream because it's so painful. But generally, taking the oral medicine is what helps, and drinking a lot of fluids. So that's shingles in a nutshell.
All right. Thank you so much, Dr. Sanusi. And thank you guys for watching. Until next time. Bye.